Hey everybody, welcome to Journey to Vitality. In this video, we're diving deep into mental health in medicine. Did you know that nearly 1 in 4 physicians report feeling symptoms of burnout? The journey through medicine is a challenging one, where mental health often takes a back seat. But what happens when the healers need healing? Let's dive into the silent struggle within the white coats and discover the ways to bring light to the shadows of mental health in medicine. The importance of mental health. Mental health isn't just about the absence of mental illness. It's a foundational aspect of our overall well-being, encompassing our emotional, psychological, and social states. It influences how we think, feel, and act in everyday life. Like physical health, mental health helps us navigate challenges, build strong relationships, make sound decisions, and live fulfilling lives. Imagine someone with good mental health. They might experience various emotions, but they can generally manage them constructively. They can cope with stress in healthy ways, and they find enjoyment in daily activities. They can build and maintain positive relationships with others. This doesn't mean they never struggle, but have the tools and resilience to bounce back from setbacks. Because mental health is so intricately woven into our daily lives, taking care of it is crucial. By prioritizing mental well-being, we invest in our ability to live a more productive, meaningful, and connected life. The global burden of mental illness. The burden of mental illness on a global scale is nothing short of staggering. According to the World Health Organization, WHO, a staggering 14% of the global burden of disease can be attributed to mental disorders. This means that mental illness is a much bigger health concern than many might realize. It impacts not only individuals, but also societies as a whole. This burden manifests in several ways. Mental health disorders can significantly reduce a person's quality of life, leading to lost productivity and disability. The associated emotional and physical strain can also affect individuals and their families. Furthermore, mental illness can contribute to other health problems, increasing overall healthcare costs. Addressing this immense burden requires a multi-pronged approach. We need to prioritize mental health awareness and education, invest in expanding access to quality care, and develop effective prevention strategies. Challenges in diagnosing mental disorders. Diagnosing mental disorders can be complex and challenging. Unlike many physical illnesses, there's no single definitive test for most mental health conditions. Mental health professionals primarily rely on thoroughly evaluating a person's symptoms, thoughts, behaviors, and family history. This evaluation often involves interviews, standardized questionnaires, and mental status examinations. However, this approach has limitations. Symptoms of different mental disorders can overlap significantly, making it difficult to pinpoint the exact issue. Additionally, mental health presentations can vary depending on a person's age, cultural background, and even current mood. This can lead to misdiagnosis or delayed diagnosis, preventing people from getting treatment. Stigma. Stigma is a powerful and pervasive challenge in mental health care. It refers to the negative attitudes and beliefs that surround mental illness. These can include stereotypes, prejudice, and discrimination. Stigma can have a devastating impact on people's lives. It can prevent them from seeking help, adhering to treatment, and living fulfilling lives. The fear of being labeled or judged can lead people to suffer in silence. They may avoid seeking professional help for fear of being ostracized by friends, family, or colleagues. This can delay treatment and worsen their condition. Stigma can also lead to discrimination in employment, housing, and education, creating a vicious cycle of poverty, isolation, and despair. Tackling stigma is essential to improving mental health care. We need to raise awareness about mental illness and challenge negative stereotypes. We can do this through education campaigns, media portrayals, and speaking out against discrimination. When we talk openly about mental illness, we can help to create a more understanding and supportive environment for everyone. Lack of access to care. A significant challenge in mental health care is the limited access to qualified professionals. This shortage creates a gap between those who need help and those who can provide it. The disparity is even greater in rural areas and low-income communities, where there are even fewer mental health professionals. This lack of access forces people to travel long distances or wait for extended periods to receive treatment, which can significantly worsen their condition. This shortage stems from several factors. Mental health professions may not be as lucrative as other medical specialties, discouraging potential practitioners. Additionally, training programs for psychiatrists, psychologists, and therapists may not have enough capacity to meet the growing demand. Uneven distribution of mental health professionals across regions also contributes to access issues. Addressing this challenge requires a multi-pronged approach. Increasing funding for mental health training programs and creating financial incentives for professionals to practice in underserved areas are crucial steps. Telehealth advancements, such as allowing remote consultations with qualified providers, can also play a role. The cost of mental illness. Mental illness carries a hefty price tag, impacting individuals, families, and healthcare systems. Direct costs include expenses for therapy, medication, and hospitalization. Managing these costs can overwhelm individuals, leading to financial strain and debt. Indirect costs encompass lost productivity due to absenteeism, presenteeism, reduced work performance due to mental health struggles, and disability. Businesses lose revenue due to employee turnover and reduced output, while governments grapple with increased social services and welfare program costs. Investing in accessible and effective mental health care can significantly reduce these burdens, improving individual well-being and generating economic benefits. Integration of mental health into primary care. Traditionally, mental health services have been offered in separate settings from primary care. This separation can create challenges for patients. They may need to navigate a complex healthcare system to receive both physical and mental health care, and their care may not be well coordinated. Integrating mental health services into primary care settings offers a promising solution. Primary care physicians, PCPs, are often the first point of contact for patients with mental health concerns. By incorporating mental health services into primary care, PCPs can screen for mental health problems, provide brief interventions, and refer patients to specialists when needed. This approach can improve access to care, reduce stigma, and improve overall patient health outcomes. Several models exist for integrating mental health into primary care. These models can vary depending on available resources and the community's needs. Some common models include co-location, where mental health professionals work alongside PCPs in the same clinic, and collaborative care, where PCPs and mental health professionals work together remotely to manage a patient's care. Telehealth. Telehealth has emerged as a game changer in addressing the accessibility issues surrounding mental health care. It allows patients to connect with mental health professionals remotely using video conferencing, phone calls, or secure online platforms. This eliminates geographical barriers, making critical services available to those living in remote areas or with transportation limitations. Telehealth can also improve convenience by offering flexible appointment times and reducing the need for time-consuming in-person visits. Studies have shown that telehealth can be just as effective as traditional in-person therapy for a variety of mental health conditions, including depression, anxiety, and PTSD. It can also be a valuable tool for medication management and ongoing support. Telehealth can empower patients to take a more active role in their mental health journey by providing access to care from the comfort and privacy of their homes. The role of technology. Technology is emerging as a powerful ally in the fight to improve mental health care. One key area is the rise of mental health apps and websites. These resources offer a variety of functions, from providing psychoeducation and self-help tools to facilitating mood tracking and connecting users with support groups. This allows individuals to access information, support, and even basic forms of treatment at their convenience and lower costs than traditional therapy. Furthermore, technology is paving the way for new treatment modalities like virtual reality, VR, and artificial intelligence, AI. VR can create safe and controlled environments for exposure therapy, while AI chatbots can offer essential mental health support and even act as a screening tool for more serious conditions. In conclusion, Addressing mental health in the medical field is complex but crucial. By dismantling stigma, prioritizing mental health education for medical professionals, and creating accessible support systems, we can foster a culture of well-being throughout the healthcare system. A healthier medical workforce ultimately translates to better patient care and a stronger healthcare system. If you found this video helpful, please leave a thumbs up and consider subscribing for more content on mental health in medicine. In the comments below, let me know what other challenges you'd like to see addressed. Until next time, stay happy and healthy.